And we understand how important healthcare is to people's lives because we work with people every single day who are having problems with the healthcare system. We see their lives ruined if they can't get the healthcare they need. We see people develop disabling conditions that were unnecessary. We see people whose lives end too soon because they couldn't get the care that they need when they needed. We see people's legal and financial lives ruined because they didn't have the protections that they should have had, even when they played by the rules and they paid for health insurance for years and years and years, and then once again it was gone when they needed it most. So we see all of those things, and so we've advocated for, you know, all of these changes and all of these reforms. And now where we are, and so I'm not trying to make a partisan statement, I'm just trying to be very clear about the policies that we support and the differences that we know that those will make. And, but people can check it out. You can go to the candidates pages, the parties pages, and you can look at the information. But basically this election is about outcomes. It's about, do we keep Medicare as it is and improve it, or do we replace it with a voucher system? Do we keep Medicaid as it is and expand it and have money flowing through the states and creating jobs and taking care of people and starting to build people's health? Or do we turn it into a block grant program? Do we keep health reform and continue to roll it out and keep those protections and those new regulations that we've gotten that have protected us? Or do we go to the bad old days prior to 2010? I don't want to go back to those days. I don't want to go back to those days. Oh, that was a personal statement. But so voting in these elections is supremely important for the future of healthcare in our nation, and not just for the possibility of universal health care, but the continuation of these major programs, Medicare and Medicaid, that so many millions of people benefit from and depend upon and deserve. And healthcare consumers, we've been very active in trying to do voter registration, voter education, and get out the vote. We have a lot of materials out there. We have had the opportunity to work with a great intern, Nicole, who's here with us, who helped put together these ballot guides. These ballot guides for the different districts show you the candidates that are running for what office and what their major endorsements are. And then we also surveyed candidates, and we have these healthcare voter guides for the Rantoul and Danville residents and Champaign-Urbana residents. And then Jen was kind enough to contact Consumer Reports and get a bunch of copies of their handout, Health Reform, 7 Things You Need to Know in case you want to get educated. And then, of course, our handout with the factual information about what health reform has done. So I just want to conclude by saying a couple things. If we want good government, we have to vote. The United States was designed to be a constitutional representative republic. However, widespread lack of participation by the citizenry has created a vicious cycle of dysfunctional government, leading to a further rejection of government by the people. This is not a time to reject government, but to embrace it and participate in it and make it work for us, we the people. No one said it would be easy or that it would be pleasant, but there are some good things that government does. Medicare is good. Medicaid is good. Regulating health insurance companies so that they serve the people and not just their bottom line is good. So only we the people can be responsible for fixing things in our own government. Refusing to get organized or work within the system because of the belief that the system is hopelessly rigged and broken becomes a self-fulfilling prophecy and only leads to further control by powerful, limited interests, and yet still results in policies that shape our lives. Even if I want to check out, I'm still going to be affected. So this is really important. This election is about outcomes. Know where the candidates stand, know where the major parties stand and what their platforms are, and get to know Medicare, get to know Medicaid and what it means for the state of Illinois, and get to know health reform and what it means for, for all of us and for insurance companies and finally regulating them and all of us having a fair chance, and also what it means for businesses so that there's a more level playing field for businesses and there's less, lost productivity because workers are sick and can't get to the job and can't get the health care they need. Learn about all of those things and then go and vote accordingly. Thank you.
I'd like to thank you for the great work you've done on your voting information, especially the grace period registration and voting. I copied that information and mailed it out to a lot of people so they would know about it. But what I found out is that here in our county, Gordy Holton has made it impossible to vote the same day when you do your grace period registration. And he's set up a obstacle course where you have to actually fill out an application to get an absentee ballot. Then you have to go home and wait for that ballot to arrive. Then you have to actually, that proves that you live at that address. Then you have to actually apply for the absentee ballot and have to go home and wait for that to arrive in the mail. And so there have been 6-day periods for these things to come in the mail. And even a person who frequently attends these lectures, Kay Bridgeford, her story has been written about in the media about how she's voted for years and years and may not be able to vote in this election because of this obstacle course that he's imposed. And this is one of only 4 counties out of all 102 counties in Illinois that don't allow same-day voting when you do your grace period registration. So I'm wondering if you've been receiving kind of this feedback from the people, you know, that have gotten your emails, that there are all these stories that have come in. Some of them are covered in the reader comments on the News Gazette article about this.
Well, first of all, thank you for your compliment, and I have to compliment our staff, especially Jen Tiaggi, on getting out the information about early registration and all the voting and all that. You know, we have heard some of these things. You know, I think, you know, if people have questions, they can always call us at 352-6533, and we can help direct them accordingly. And I think, once again, I think back to Dan Johnson's talk when he was here a few weeks back, and he talked about the right to vote and the different ways that we could do it. And it actually made me start thinking about things that I had never thought about, like the fact that why aren't people just automatically registered? Why do they have to go? I understand changing your address, but why aren't you just automatically registered when you turn 18? You sort of get automatically registered for Medicare, right? Before your 65th birthday, you start getting stuff in the mail from Social Security, and you know